service we are going to do is laser treatment for melasma. Melasma is a pigmentation which is seen uh, mostly in women, also in men, and the site of occurrence is on the cheeks, nose, forehead, just above the eyebrows. But sometimes it may extend lower down on the upper lip area and the lower cheek, neck also. This is seen mostly after during pregnancy because of hormonal disturbances, and patients who are taking oral contraceptive pills, steroids, they also develop this pigmentation. Women who approach menopausal period, melasma is seen most commonly. The pigmentation is increased in intensity when they expose to sunlight. So the shade goes darker from light brown to dark brown or coffee brown. And sometimes it may occur on the different sides which we already discussed. Also it occurs on the nose, on the bridge of the nose. It is called as the butterfly distribution. Okay. Now the treatment for this pigmentation is, of course, primary care is using lightening agents and the use of sunscreen to protect them from further getting the pigmentation shade getting darker. Secondly, we have various options of treatment, right from chemical peel, mesotherapy, yellow peel, and lasers. So in lasers, we are now doing this NDN laser treatment, which will be focused only on the pigmentation. It will not be on the entire face. So the client prepares the skin by applying top lap gel or any anesthetic cream for 1 hour before the procedure, so that they don't experience the pain. And while doing the laser, there will be little redness, slight swelling, which is explained to the client. This redness will stay for 2-3 days, and later the area may go little brownish in shade, which will stay on the skin for another 2 to 3 weeks, and then the shade goes lighter. So all this needs to be explained to the client, and they have to initially use antibiotic cream for 7 days, and then just a moisturizing cream and sunscreen to allow that crust whichever occurs on the treated area to fall off easily. Uh, they can do their other beauty parlor activities only after a period of 7 to 10 days. Okay, so now we start the services. We have already placed the cap, chest towel, and given the protective eyewear. I've already cleansed the face with a cleanser, and it is dried with a tissue. The laser is on. The screen shows the. Now there are various options. 5 options are given. We are going to use the pigmentation therapy. These are the readings which is already set in the machine. 300 millijoules. You can go a little less to 90, or you can increase to 350. But to start with, we will use the 300 millijoules. This is the second session of the plant, so we can start with 300. It is very easy to operate. Again, if you have your expertise, you can increase the frequency. Otherwise, you can reduce the frequency to 5 Hz. And you just have to start the button, and the machine starts. The foot pad, ensure that everything is arranged. You take proper position, the foot pad is placed appropriately, then only start the on button. Okay. The size of the laser where the area is targeted is 2 mm. Now I start the service. Stretch the skin. areas which are targeted becomes shows frosting, titration appearance. ठीक होते हैं, ठीक है ना, थोड़े बंद रखिएगा. Don't place the laser shot on any nevus. Avoid the nevus.
Maria.
तेवढंच होतं ना. खाली कुठे नाही ना, चीकवर बेरेबल आहे ना. So once we have targeted all the areas, now we will first press the stop button, take the readings. We have given almost 2321 shots. Go back and turn the key off. Place the probe on the NP stand. Remove the protective eyewear. And apply cooling gel on the area which we have treated. We leave it for some time till the client feels better and apply sunscreen and give instructions as discussed before. The care is applying antibiotic cream for 7 days, moisturizing the face 3 times a day and applying sunscreen before going out. No facial or any beauty parlor activities for the next 7 days. No lightening agents for the next 7 to 10 days till the redness goes off completely. We'll apply the antibiotic cream and then apply sunscreen.